discussed. This disclaimer complies with California Business and Professions Code 651 regarding healthcare advertising.
Well, good evening again. This is Ash, Dr. Afflalo, and yes, we have the physician herself in Dr. Suzanne Afflalo. Good evening to you.
Good evening, Dr. T. How are you doing today?
I am fabulous and just excited about what God is doing because there's so much going on. Let's just really quickly just tap in. I know that this is a local story, but any updates on all the major fatalities that took place with the plane crash today happen to be close to your neighborhood?
Yeah, so there was a Cessna plane that went down in Terrasanta in the military housing area, about 2 to 3 miles away from me. My understanding is that it probably hit and damaged 15 homes and several cars that were burning. But my understanding, there's no fatalities on the ground. None of the families that live in those homes were affected other than minor injuries, and that we just know that the fatalities were the ones that were on the plane. I just don't know the last count on how many people were on the plane that went down. It was like 4:30 in the morning. I don't know why they were flying over to Montgomery Field at that time, because there's never flights during that time. They're always in the daytime.
Mm-hmm.
So that's a little confusing. And I was up around 3:30. It was very foggy.
Yes.
So the fog might have played a big part on them coming down.
Yeah, I really think that too. The funny thing about it is that our offices are in the flight path,
Mm-hmm.
and so it's always very concerning. But then I said to my wife this morning, I said, but our house is in the flight path,
Mm-hmm.
and so, but by the grace of God, people were in their beds at home and sleeping. Cars were caught on fires, houses were damaged, but yet there were no fatalities or injuries per se on the ground.
Exactly.
And so that is a miracle in and of itself, saying that the pilot was trying to do something right. And it seemed like that he saw that a street, and maybe that was the only place he could see to land.
Mm-hmm.
But it's definitely always sad that any souls that perish in these Cessna plane crashes.
Absolutely.
Now, how do you when these type of traumas happen? How well, what I was listening is they said that they have this whole response,
Mm-hmm.
and all the different agencies, and this time even the military was involved because it was military housing. How does it impact physicians in the city? Is there an all call for physicians, or just hospitals supply their own physicians?
Yeah, it's just the hospitals. Usually it's just the fire, police. The military was obviously affected their community, and I do know local government was there.
Mm-hmm.
And so, but no, the local physicians, they don't need extra bodies there. If they have to
Mm-hmm.
transport anyone, it's to the local hospitals, and they're well manned for nursing and physicians.
Okay. Well, it is a tragedy, but, we as people of faith will continue to pray for the family and to just really ask God to do what he does, and that is always comes through.
Absolutely.
Amen. Well, what is this? What are we talking about today? Because word on the street is that it is Men's Health Month.
Yeah, June.
June
Coming
is
up,
Men's
yeah.
Health. Okay.
Yeah.
So, well, since we're going to talk about June, let's talk about the health fair first, and then let's go into Men's Health Month. And I want to know everything about keeping a man healthy. You know what I'm saying? Tell me, because I'm gonna take notes, because I want to be a healthy man.
Absolutely. So yes, June is Men's Health Month. So the health fair, which is on June 4th, the first Wednesday of the month, we are focusing on men's health. And it's really just a reminder to our community, to the women that have men in their lives that they love and care for. We want to make sure that they're reminding them to not only do the proper things of taking care of their health, but eating right, sleeping, exercising, avoiding the things that can affect their health, tobacco, alcohol, drugs, things like that. But the Men's Health Month, our health fair is every first Wednesday of the month. It's held at the Jackie Robinson YMCA from 10 to 3. And the basic things that are there are the routine screenings for diabetes, cholesterol, hypertension. We do have breast exams for the women, and then all kinds of other screenings. At least 40 to 50 vendors, and some of the large mobile vans. Kaiser's van is there. San Ysidro Health giving vaccines. San Diego Humane Society providing health care for your pets. We do have UCSD Shiley Eye Clinic that does free exams and free glasses. HIV van. There's just a lot of services there, so it's the best one-stop shopping for your health in the community, Southeast San Diego, and we've been going on for 8 years, so this is just another month that we're preparing for. And the good thing is we are starting to see improvement in terms of the numbers, so maybe the word of mouth is starting to spread. We're seeing about 300 to 350 people each month. So the more we can see, the more lives we can try to save.
So very excited about it. Let's talk about how long have you been doing this health fair, and when did it all come about? Did you just wake up one morning and say, you know what, I'm going to start a health fair?
So it did start 8 years ago, February 2017. Myself, one of the nurses at Kaiser, and my partner in crime, Wendy Sherrills, that has the Many Shades of Pink, we all decided that we were doing something down at the marina on Harbor Drive, and we decided we wanted to do something more consistent instead of once a year. And so we came up with the idea somewhere in September, October of 2016, and by February of 2017, we were launched and haven't looked back since. So every single month, other than January now, because first Wednesday is very close to New Year's Day, I decided to give myself a break. So February through December, we have a monthly health fair. This is our third location. We were at the Big Lots on Federal and Euclid for a couple of years, then move over to ECC, the City College campus for 3 or 4 years, 3 years maybe. And when COVID hit, we moved over to the Jackie Robinson YMCA parking lot. So we've been there for at least the last 4 or 5 years. They are a wonderful host. It brings about the foot traffic of the people that are members of the YMCA, but also the community. So it's a good place to be, and we get to serve the community easy access. We're just kind of outgrowing the space because of the parking, but we figured that out.
Well, wonderful, wonderful. Well, let's get to our topic for the day.
Okay.
Men's health.
Yeah, so you tasked me on trying to cover a few topics, so I'm going to do my best to cover the ones that you wanted to hear about, but mostly stress, erectile dysfunction, and prostate cancer.
Well, I basically want you, because you're the doctor, and so, we just go for the ones, they say men have stress, they have ED, they have hypertension, they have all these different things. So as the doctor, I want you, if I'm coming to you as the patient, and all these other men out there coming to you as the patient, they said, we need to know how to be healthy. Whatever you're going to discuss with us from that point on, that's what we want to hear today.
Sounds like a plan. So obviously, the most important thing for any type of health issue or trying to stay healthy is to balance your whole being. So that is getting the proper sleep, eating properly, exercising, taking into your body what's going to be good for your body, and avoiding the things that are going to be toxic to your body. So avoiding, tobacco, alcohol, drugs, illicit drugs, and things like that, and trying to make sure that if you do develop any chronic medical conditions, that they're well managed so that they don't affect you on a chronic basis. And that those are some of the underlying things that affect actually ED. So just in terms of stress, everybody has it. It just depends on how you address it, how you approach it, how you deal with it.
Can I ask you a question? In the layman's term, what is stress?
Stress is life. It's everything that you deal with. It's, driving on the freeway. It's family dynamics. It's financial. Stress is just the way how you view things and how you address it. So some people don't feel like they have a lot of stress because they don't let certain things, like smaller things, bother them. And then there's certain people that focus and allow small things to affect them, their health. Their mental health, their physical health. So if you are feeling stressed, living in this world today, especially with the climate, the political climate we're in, almost everyone's suffering with some level of stress because things are being taken away from them, rights are being taken away. So it's how you deal with it and how you allow it to affect your body. So, people get things like headache, neck pain, abdominal pain, you name it, they get it. They're physical symptoms. Lack of sleep, can't sleep at night, can't turn your brain off because you're worried. You can have stress on the job, which means it's a hostile environment where they're constantly harassing you. And so you internalize it because if you speak out, you're going to get fired. And then if you get fired, you can't pay your rent, your mortgage, your car payment. It's a snowball effect. So really just kind of figuring out how to manage your stress by dealing with, meditation, exercise, whatever it takes, whatever you like to do, listening to jazz, taking your dog for a walk, whatever it is to decrease your stress level is what is going to help you get through your day to day. And try not to let the stress affect your physical being.
So let me ask you a question. In the sense of men, you know, they say that because men feel like they're the provider of the family, that they're more stressed than women. And then not only are they more stressed than women, but as a black man in America, that adds another layer of stress. What would you say to the black man in America on how to deal with his stress?
Take a deep breath.
Take a deep breath.
Yeah, so it's true. I mean, just being black in this world is is difficult, and depending on the situation, of course, men, because there it seems like there's targets on them about the for the women, it's the stereotype of an angry black woman. So if you express yourself, you're angry. For men, they look intimidating. So the taller you are, the bigger you are, people are afraid of you just because. You could be as a gentle giant. But the stereotypes are what makes us deal with stress. I mean, when you step into an elevator and everybody's clutching your purse and stepping aside, what is that about? You know, even if you're saying good morning. So there's microaggressions. There's stress everywhere around us, and we know it. We've been living with us. We've been in this skin for a very long time. A lot of times we know how to handle it, but some people get overwhelmed with their stress and they turn to things that affect their health, and that is drinking or, staying up too late or whatever it is that then takes a toll on their physical being. And then that's when things happen. So yes, black women, we are under a great deal of stress. We're under attack by everyone. And so we have to learn how to we turn to our faith, but we can't just deal with faith only. That we do need to do the works, and that is trying to eat right and not, sit there because you're overwhelmed and eat a pint of ice cream and then drink two,
Wait a minute, you tell me a pint of ice cream is too much to eat?
Yes.
It's only like,
Yeah, I know, a pint, I know.
Okay.
But that's every night because you're stressed every night. So
no,
you can't
we
do it.
don't want to do that every night.
No.
Okay.
No. So, and drinking, some people turn to alcohol and tobacco or whatever. So we cannot attack or deliberately attack our body because we're stressed. We have to figure out another way that's not toxic to our own body as to how to deal with the stress.
Now, I want to know, maybe you can help me. Do you think I could file a lawsuit against Haagen-Dazs Swiss Vanilla Almond? Because they put it in a little pint, but it'll call you in the middle of the night. And I think that there should be warning labels, could be addictive to your health.
Well, you can't sue. I'm sorry.
Oh, okay.
Yeah, because it's by choice. You go over there and you pick that up, and just don't go down that aisle and pick it up.
Okay.
Yes, there's no warning on it, but they do have calories and carbohydrates listed on there and tons of sugar on there. So that is your warning label. You just have to know how to read the label.
And the funny thing about it is that I tell people never go shopping, grocery shopping when you're stressed. And it's funny because I was like saying you could only at one point could get vanilla Swiss almond Haagen-Dazs. I'm advertising for you all in the regular grocery stores. And then all of a sudden one day I walked to 7-Eleven and I walked past the freezer and it was like, "Hello, we're here." Hello, and I said, "Hey, this ain't nothing but the devil."
Yeah, they're putting it everywhere. It's accessible. Sugar, salt, those types of things. They are addictive just in themselves, and so you have to be careful. Yeah, I mean, it takes willpower and things like that. But if you're trying not to fall off the wagon of hurting your own body, because that can't help. All that sugar is not helpful for your body in terms of weight and diabetes and things like that.
Now, can I say this? We talk about stress and we talk about self-medication. Alcohol, drugs, things of that nature. But very rarely do I hear anybody ever talking about self-medicating through food.
Oh gosh, yeah. Stress eating?
Yes.
Oh, that's a big thing.
Yeah.
So there's people that, depending on how they handle their stress, that's what I'm saying, how you handle your stress. Some people don't eat and they lose weight, and some people eat, and that's the only way to soothe the stress that they're dealing with. So you have to determine how you handle your stress and figure out how you can change those habits that can affect your health.
Yeah, because I was addicted to fried chicken in my stressful days. It was like crack, It just take one bite, and I was like, "Oh my goodness, the day is better already."
And then you can't let it go. It's like the chips; you can't just eat one. So you know. But yeah, there's all kinds of symptoms with stress. People get anxiety, so they can get chest pains, palpitations, headaches, things like that. So stress really is. I say that stress is like leading towards cancer. because if you're not careful, the stress will start affecting your body, which can cause changes on your cells. So the cell types. So I would just say that you do have to figure out how to manage your stress. There's no one that isn't dealing with stress, but some people just deal with it better.
So let me ask you a question. A lot of times people say, "Oh, you look stressed." Well, but what if you don't identify it as stress? What if you just identify it as, "Oh, it's been a long day and I'm tired." What are the alarm signals to say, look, even though you're not calling it stress, it really is?
Well, if you if you are minimizing or ignoring it, that's not a good thing. So, I mean, if you're constantly having headaches or neck pains or stomach issues, you're running to the bathroom every minute, something's not right. So, if your body is not normal, not functioning normal, you should not have a headache every day. You should not have stomach ache every day. You should not have neck pains every day. So, you have to go and seek out advice. So go to your provider and find out, why am I having these headaches every day?
Okay.
It could be your environment. You could have mold in your house causing you allergies and headaches and things. You could have, stress is definitely it, but you want to rule out the other things. Neck pain could be a pinched nerve. It could be muscular tension. It could be whatever.
That you need a new pillow.
It could be that too, if you're not sleeping properly. So there are so many things that you can't just chalk it up to stress. But if you know that you were fine last week and now you're having all kinds of issues, and you know that there's a boss at your job harassing you, you can put two and two together and know that the stress is what's causing your physical symptoms.
Okay. And sometimes it shows that it's because you just want to sleep all the time.
Yes.
You're physically
Yes.
tired. And, so that's about stress. Let me talk about the stress as a man of getting older. You know what I'm saying? We recently had to purchase a new bed. And because, you purchase your beds after a certain amount of years, it's time to get a new mattress and everything else. So as being an older gentleman now, I refuse to get a Posturepedic, I think it was, adjustable bed.
Yeah.
Because I'm like, look, I'm not that old and I don't need a hospital bed in my bedroom. And everybody said, "Oh, once you have it, you're going to love it. You're going to love it." So I refused to get the Posturepedic, right? And I tell you, it was a couple of months of pure misery. But when I got the Posturepedic, the older body said, now we're doing something.
Thank you, right? It said thank you. Yeah, I know you fought it because I think Michelle's the one that wanted it. And you were like persistently saying no because you were going to give in, like there's some label or something.
Well, back in the day, I'm old school. Back in the day, if you had an adjustable bed, that meant that you was either sick or in the hospital. We didn't see those in homes because, in my neighborhood, if you had to prop yourself up, you just added more pillows.
Yes. Now we're in an age where they're making them automated. They're there for people, and it's very comfortable. So instead of propping yourself up to try to watch TV in bed or something, you can actually, elevate the bed. Plus, I mean, it's good for certain medical conditions. If you've got acid reflux and you're constantly having sore throat and that sort of thing on the back of your throat, the elevation of the bed, which we tell you to do, which most of the time you have to put a wedge or something, that is what you can do. Elevate the head of your bed so that you don't have reflux going into your throat.
Yeah, and I think that especially if you have sinuses too, just a little elevation. And it's funny, now that I'm a believer, I sleep with a slight incline just so that my body aligns well.
Yeah.
Yeah, and so men's health, what I'm saying? When should we, and this is going to sound crazy, but when should we begin to take care of ourselves when we know we need to take care of ourselves?
Well, you should start taking care of yourself when you're old enough too. So
Okay.
Teenage years, I mean, normally your mother, your parents are taking care of you in your younger years, trying to make sure little Johnny go and sleep, go and eat right, that sort of thing. But really, when you realize that health is important, it should be in your teen years, young adults. The problem is most people are healthy at that time, and so they don't think anything's going to happen to them. So they ignore it. They don't go and get their exams or their labs, and then they hit about 30 or 40, and then they start having ailments or injuries, and that's when we'll see them. But the problem is it's kind of late for doing routine things. You've already been eating wrong for the last, fried food and alcohol and sugary beverages for the last 20, 30 years, and now it's starting to take its toll. And you can't undo that. The damage is done already. So if you've developed diabetes at 40, then now we've got to figure out how to control that. If you gained extra weight, we've got to try to help you get it off so that it doesn't put you at risk for more problems. If you have high blood pressure now because you've been eating a lot of salty foods in your diet, we've got to teach you how to eat properly and then try to control the chronic condition that you've developed. So there are still, it's never too late to get involved in your health, but we'd like to prevent it from the chronic medical conditions from developing so we don't have to manage it, but we can continue to prevent it. So I say get involved in your health as early as you can.
Okay. So I'm going to ask you, in the sense of foods that are good for men to consume on a consistent basis that will keep them healthier and stronger, I'm going to ask the question because I'm had this affinity now for avocados. Is there such thing as eating too much avocados?
Everything's in moderation. So
Okay.
avocados are wonderful, but they're fat. And they're a healthy fat, but nonetheless, if you can't eat 12 avocados because it's not calorie free,
Yeah.
and there's only so much fat we want in our diet, even if it's healthy fat. So you can have an avocado. If it's a large avocado, they recommend a half an avocado for the amount of fat. If you're trying to have a well-balanced diet, there's so much protein, so much fat, so much carbs, right? And so, of course, if you're going to have a fat, you want it to be a healthy fat. And so that is fine. I mean, there's certain fats in nuts, but some of them are more higher in calories. Cashews are higher in calories than, say, walnuts or something like that. So it's about doing your research and choosing the healthier of them. So avocados are wonderful. I love them too, but I'm not going to sit and eat 3 at a time.
Oh no! I've gotten into this whole thing courtesy of my wife, avocado toast, and so probably every other day I have an avocado toast that I handmade because I'm so fortunate to have a colleague that has an avocado tree, and when I tell you that these avocados are so delicious, and I'm amazed because you know how you get them from the store and the outer core is very hard, and sometimes her avocados, the core is actually soft, almost as like a fruit that you could just eat right through it because the skin is so soft, and even when the outside gets dark, the inside always stays
So,
bright.
yeah.
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 So
No, there are different strains of the avocado too. So some are on the rough, you'll hear them, they advertise Haas. And then we get them a lot from Mexico or from Chile or some places. But they do have to pick them a little early in order to get them here ripe. So you can't pick them right because they'll spoil in a couple of days. So
exactly.
that's the beauty of having a neighbor or colleague that has avocados. You can pick them when they're ripe and you can eat them and they're delicious. So yeah. Good.
So that's a good fat. Nuts are a good fat. So let's just talk about, and I want to talk healthy meals. Especially for men. If you were to say to a man, okay, we know that you want to eat a breakfast in the morning. You might want to do lunch. You might want to do dinner. What would be a good, healthy morning breakfast? Because we're getting mixed signals. People are saying that eat oatmeal. Then you hear other people say oatmeal just triggers something else in you. So what would be a good, healthy meal to start off in the morning?
Yeah, I think it depends on what you like to eat. I don't like oatmeal,
Okay.
so you won't get me to eat that. But, you want some level of protein, whatever that is, a lean protein. So whether you have, you can have an egg is a good thing. It has protein in it, the white. The yellow is a cholesterol, so you can't eat too many of the yolks. So a protein, some kind of a grain. So if you want a whole grain slice of toast with an egg, or if you want a protein shake with a lot of green veggies, kale and spinach in it, and a scoop of protein powder with you can put some chia seeds and stuff. You can be creative, but it has to be something you like. So you can't just eat, certain things. But I think a healthy protein, a small amount of carb, whatever that is. You can put your yogurt in your smoothie if you want that. But most people, the way they go off the wagon is they have a lot of fruit in their protein shake, and it's too much sugar. So a protein, lots of green leafy veggies, and maybe something like an apple to sweeten it, something like that.
So let me tell you, my protein shakes, when I make them, I like the kale and I like cucumbers because they have a little refreshing. And then I do like a little bit of banana and then a squeeze of lemon.
Yeah.
And you won't even guess what I'm using for sweetener.
Your banana should have been your sweetener, but what's your sweetener?
2 dates.
Okay, yeah, dates are very sweet.
Yeah. And it's almost like having little chunks of candy.
Yeah.
And-
But where's your protein? I haven't heard the protein yet.
well, that's the question. I've done flaxseed, not
Yeah,
flaxseed,
plus chia seeds
and chia
and
seeds.
flax. Is that enough, or do you have like a scoop of whey protein or something?
Well, see, that's what I'm asking
Yeah.
you because I don't do the protein.
Yeah, then you're not getting your full balanced
Okay.
meal. So you can find a protein. You can even actually put a scoop of, which will help your fat and your protein, is like a scoop of almond butter or peanut butter or something like that.
Okay. So peanut butter. So almond butter. So when you think of butter in its true sense, almost everybody thinks that is bad for you. So why is almond butter better than is almond butter like peanut butter or is almond butter like butter?
It's like peanut butter.
Okay.
It's a nut that they process and make into a butter, and that's going to be a healthy form of oil and also a protein. But and some people prefer that to peanut butter. So it just depends. That's your personal choice. And butter, if you're going to do some kind of animal product, butter is definitely, I think, healthier than margarine because it's not as processed and have all the other added ingredients. So as close to natural as you can get. Milking the cow and processing it there, making sure it's pasteurized. But I would just say that you still have to use all that in moderation because it still has the risk of having lots of calories and the higher fats where you can get some clogged arteries over time.
Okay.
Yeah.
Okay. All right. So we talked about stress. We talked about healthy eating. What is too late to eat?
Oh goodness! Don't ask me that because I eat my dinner at like 1 a.m, but then I'm going to bed like 3 or 4. So it really depends. It's how you process your day. Meaning, if you get up late, you want something. Breakfast is when you break your fast. So it doesn't have to be 8 a.m. It doesn't have to be noon. But you want to give at least 2 hours, preferably 3 hours after a meal before you lay down. You want to get it past your stomach. So it really depends on how your day is structured. I mean, obviously people work a night shift, so their dinner's not going to be 7 o'clock at night because they're going to be up until 6 in the morning. So your heaviest meal should be earlier in the day when you can digest it and process it. And so there's no actual time.
Okay, so I'm going to ask this question because every time we get close to summer, I get very, very addicted to watermelon. So talk to me about the good and bad of watermelon.
Watermelon is refreshing, but it's sweet as all get out. So if you eat a lot of that, please don't do a lot of that if you're a diabetic.
Okay.
It's very refreshing. It's great in the summertime because it's cool, but too much of it is still not good. I mean, you can give that to a child, but as you get older, it can put on it's sugar. It's natural sugar, but it's still a lot. So don't eat that half a watermelon. It's just a lot of sugar. And unless you're going to do something to burn that off, then it's going to find somewhere to be. If it can't be stored, it's going to go on your body.
Yeah, and the funny thing about it is that after a workout in the morning, just a little bowl of watermelon just makes my day.
Yeah, and I think that's fine because you've burned off some calories, and as long as it's a small bowl and not a platter full, because some people get carried away thinking fruits don't have calories, but the amount of sugar that you get in a platter of fruits can be dangerous, especially for people that have diabetes.
And the funny thing about it is that I used to hear back in the day that watermelon was a great way of hydrating yourself or keeping yourself hydrated.
No, it is. It's very hydrating, but so are cucumbers with less calories. Cucumbers are very refreshing, very hydrating. Have a lot of water in them.
I got to ask the question, but what if you have cucumbers dipped in vinegar?
I've never even heard of that.
You never heard of
No.
cucumbers soaked
I
in
guess that would
vinegar?
be like a pickle, right?
Yeah.
Yeah. That's kind of tangy, but how much of that would you want to eat?
Oh, you throw some tomatoes in it, chop it up, you got a cucumber salad.
Yeah, I think that's fine. Once again, in moderation. Vinegar is not the issue. And cucumbers are not the issue. And tomatoes are not the issue.
Okay.
So I think in that situation, it would be fine.
Okay.
Yeah.
So let's talk about because I'm sick of the commercials.
Oh, the erectile dysfunction?
Yes, I am sick of the commercials. And I'm concerned because the internet got all these different ads coming on, convincing people you take this pill and everything is going to be all right. I'm concerned because obviously if it was that simple, it would not be an issue in the medical world.
Well, erectile dysfunction, keep in mind, there's a reason why it happens. Not everybody suffers with it, and it's not necessarily something just because you're getting older. But most of the time, the reason why it happens when you get a little older is because you've got some underlying medical conditions that affect the blood flow to the penis. And so if you've got high cholesterol issues, your arteries in your heart and your brain and everything else are not the only arteries that are getting clogged. And so in the vein too. So if you have high blood pressure, cholesterol issues, things like that, you may very well suffer from erectile dysfunction. And if you don't correct those problems, all the medications in the world, it'll help you temporarily, but it's still just a Band-Aid on an underlying medical condition that needs to be addressed, because then you can just have a massive heart attack, because you've avoided the hypertension, the cholesterol, and the clogged arteries, right? Heart disease. So it could be a sign of heart disease issues. So you can't just ignore it. You need to go and see a provider that can work you up and make sure you don't have underlying chronic medical conditions that need addressing before you just address the symptom, which is erectile dysfunction.
So here's the question. So if you have hypertension, that could lead to erectile dysfunction. Now, if you correct your hypertension, does that correct the erectile dysfunction?
Possibly to a certain degree, because it may not be that by itself.
Okay.
Right? So you do want to correct as many underlying chronic medical conditions that you have, which gives you a better chance of correcting the symptom of it. But it may not be the only thing. But if you correct all those and they're controlled, then you can use a medication, which we have prescribed, to help the gentleman be able to perform.
Okay.
Yeah.
So so we've heard about medication, but there are other things that people are using to help with erectile dysfunction, including pumps and
Yeah.
prostates and all the other stuff. How healthy are those?
Well, I mean, there are definitely pumps. Pumps are not going to be an issue. That's more of an outside. It's a plastic device that you put on the penis and you just pump it up, and you'll get an erection in 10 minutes and it'll last about 30 minutes to 60 minutes. That doesn't necessarily affect you with your internal health. There are injections that you can actually inject the side of your penis that actually does help to relax the smooth muscle and allow blood flow into the penis. There's also surgical device where they actually put an implant in. I mean, it depends on the risk factors. Most of the time, those are going to be safe enough. I'm not sure about the injections as much, but the pump and the implants are okay. And then we have obviously there are side effects to the medications, the Viagras and the Cialis and things like that. If you've got an underlying heart condition, those can cause stimulation and affect, elevating the blood pressure and things like that. So there are definitely physical things. You definitely want to make sure you don't have clogged arteries anywhere, because I promise you, when you take that medication, it can affect all the other areas of your body that affects the blood flow.
So what does the medication really, really do? Does it just relaxes everything? What does it actually do?
My understanding is that, depending on the basic ones, relax the smooth muscle in the penis and allows blood flow to it, and that's what ends up creating the hardness of the penis in the cavernous venosus. So it's filled with veins, but you need blood flow in there.
Okay.
Yeah.
All righty. Our next topic, prostate cancer.
Yeah.
And our former president is suffering from prostate cancer, and I'm kind of confused. And the reason why I'm kind of confused is that he was president for 4 years. He was vice president for 8 years, supposed to have the top medical people around him all the time. How did it sneak up all the way to stage 4?
Well, to be honest with you, the recommendations are basic recommendations for screening for prostate cancer. When we order a PSA, they recommend 50 to 70 because you tend to get it more when you get older. But after 70, obviously he's 82. So they pretty much probably stopped screening. I believe they said that his last PSA was 2014, so that was 10 years ago. That was about right at age 72. There can be a discussion. Usually it's if you think you're not going to last more than 10 years. So they stop at 70 because average studies show that maybe men don't last much more longer than 80. But the routine screening was the reason why he didn't get tests every year. And unless he asked for it or had a discussion with his physician, then there was no reason to order it. We recommend, the recommendations are that we start with African Americans at a younger age because the black men tend to get it earlier and sometimes it's more aggressive. So we actually start screening black men at age 40. And if they have a family history, even age 35, depending on the situation. So age 40 and every year so that it doesn't start creeping up on you. Because the numbers do grow slowly and there is a range for it for the age that you're in. You know, say if you're 45 and 55 and 65, there's an age and a range for that age. But there was the reason why he has a stage 4 and it's in his bones is because they just stopped screening. So somewhere between 72 and 82, his PSA level started elevating. And the only reason why they found it and diagnosed him is because he started having, I believe, blood in his urine. And when they started working that up, you know, most likely they did scoped his bladder and didn't see any, you know, lesions for bladder cancer. And then you start looking for stones and everything else and do a PSA and they see it's elevated. I don't know how high it was, but elevated enough. And then they started doing scans, I'm sure. Bone scans, PET scans to see if it had spread out of the prostate. And that's how they diagnose him with stage 4. Anything outside of the actual organ that's affected becomes a stage 3, stage 4. So I'm not surprised. I mean, it's not like somebody failed him or someone neglected him. It's just the normal recommendations, which means now we need to review the recommendations of do we stop at 70? Or do we still have the conversation and let the gentleman decide if he doesn't want it anymore?
Okay.
Yeah.
Okay. And so are we seeing a rise of prostate cancer, or are we catching it early so that we are able to deal with it? And are men ignoring it, or are men really taking advantage of the new medical nuances?
I think overall we're getting better at having the conversation. You know, some men will come in and ask, hey, I want a PSA. If we're doing a routine set of labs annually, we should be discussing it, especially if they're the proper age. We should be, you can order it, but you should let them know that you're ordering it because some of them may not want. But I would say men are just getting more aware, especially the African American men. They know that prostate's all around them, prostate cancer is all around them. Their family members probably had it, their father probably had it, so they know to start screening earlier and to ask for it every year and to get on it. Because if you can diagnose it earlier, you can treat it earlier and have success. So there's this motto or this saying that you can either, depending on the aggressiveness of your cancer, you can either die with prostate cancer or you can die from it. So if it's aggressive, you're going to die from it. If it's low grade, you'll die with it, meaning you'll treat it, but that's not what's going to take you out off of this earth. It's going to be something else, heart disease, diabetes, complications. You'll have prostate cancer, but that's not what killed you. And that's actually what my father, he died from a heart attack, but he had prostate cancer for many years being treated. Okay. And then I had a brother that had prostate cancer. It runs through the family and is very prominent in the African American community. So I do recommend that African American men, our black men out there, start getting screened at age 40. Ask for it every year. If your providers do not want to order it, please find a new provider because that's just not okay. And so the basic screening is we used to do rectal exams, digital exams. It's not as necessary anymore because the PSA does give you an indication. You can do a rectal exam. It will only give you the lobes, the posterior lobes, but if you see enlargement, it could just be an enlarged prostate. So an elevated PSA doesn't necessarily mean cancer. It can actually be an enlarged prostate. Okay. And so we need, or prostatitis or something like that. So we need to make sure we're not just biopsying everybody and labeling everybody. When if you get to the thing where the PSA is increasing, you follow it and it's increasing, by all means you have to get evaluation, get biopsies, and then pathology to make sure that if it is cancer, what's the Gleason score? Meaning that's the rating, that's the grading. The higher numbers of Gleason scores, like a 6 to 9 and 10, means more. 6 to 7 would be more low grade, and 9 and 10 would be a more aggressive type of cancer, prostate cancer.
Now, the reason why I asked a lot of things about stress and the other thing about high blood pressure, because of the fact that when we think of prostate, we also think of the fact that there comes the erectile dysfunction. So when someone has prostate cancer and they have the surgery, how some people wind up with erectile dysfunction. And is that something that's just a gamble? Because I think a lot of men are afraid to find out about prostate or even have anybody do anything with prostate because they don't want to lose the other thing of having erectile dysfunction.
Well, I think there's so many other treatments besides surgery, and it depends on how far along you are
Mm-hmm.
when you get diagnosed. Because you can do radiation, you can do ablation, you can do all kinds of other things, hormonal therapy. But if you're further along and it's very aggressive, you want to remove the entire prostate. Now, when you have a prostatectomy, remove the entire prostate, there's nerves that run right there that if you are removing the prostate, it's very possible that you can nick that nerve, which supplies the innervation to the penis, and then you have problems with erectile dysfunction. They tell you when you do surgery that the complications are you could certainly have bleeding and some urinary incontinence and things like that, but erectile dysfunction is going to be one. Over time, it can get better, but not to the point where it's 100%. So that's the risk you take. But you can also, if you have an aggressive form of prostate cancer and you don't do much about it, or you avoid the surgery, then you'll die a whole lot sooner from your prostate cancer just so you can avoid erectile dysfunction. I don't think that's a, a good gamble, you know. So if you want a longer life, try to screen, diagnose early, probably not have to do radical surgery, and then you could avoid the risk of having erectile dysfunction. But yes, that is a significant side effect.
Okay. The question on the table was, what is PSA?
Prostate-specific antigen. So the antigen, which is a protein, is made specifically by the prostate. That's what we measure in the blood.
Okay. All right. So let's now get to hypertension.
Okay.
You know, and what really causes hypertension? And is this not about the salt, is it?
No, I mean, that's a contributing factor. But hypertension, there's so many factors involved with it. I mean, genes, hereditary, certainly can put you at risk for it. Weight, tobacco, alcohol, all those things raise your blood pressure. Stress raises your blood pressure. Having cholesterol and narrowed arteries and stiffened arteries can raise your blood pressure. So there's so many things contributing to it. So that's why it's important to get your blood pressure checked, know your numbers from your earlier. You know, when you're younger, you should be running into 110s over 60s or something, like 100 over 50 when you're younger. If you're an athlete, you stay, in the lower ranges. When we start getting older, you can raise it to 120 over 80. The basics is less than 120 over less than 80 for systolic and diastolic blood pressure. Systolic being when the heart pumps, the pressure goes out into the arteries all over your body. That's the top number, systolic. Diastolic is when the blood's coming back. It's when the heart is resting. So pumping and resting. Those are the two numbers.
So if you have a blood pressure of 50 over 150.
150 over 50.
150 over 50. What does that mean?
It means your heart is pumping against the pressure. So the arteries out there that it's pumping against is either filled with some cholesterol or stiffened or something. You're pumping against pressure.
Okay.
So we've got to figure out what that is. So you have to look at the cholesterol. Are your arteries narrowed from cholesterol? And that's what it's pumping against. Are the walls stiffened? So it doesn't, the walls aren't flexible.
Okay.
Yeah, elasticity. So there's a lot of things that affect it, but yes, diastolic usually tends to be on the lower end, but you can have a higher end diastolic, which means the heart is still working. So systolic and diastolic is pumping and resting of the heart. Blood pressure affects it. The more you're pumping against stiff arteries, the harder your heart has to work. So when you have high blood pressure, you end up getting something called cardiomyopathy or left-sided ventricular hypertrophy. That means the left side of your heart that pumps the blood out to the main part of your body gets big like a muscle, hypertrophy, big. So that chamber, that one of those four chambers gets larger because that's the one that's pumping hard against the resistance of your pressure in your arteries. So when you see somebody with left ventricular hypertrophy on a EKG or on a chest X-ray where the heart is floppy, big floppy on the left side, we know that you have high blood pressure. That heart's been working hard for a while. Not just yesterday, not just 2 weeks. So we do need to monitor blood pressure so that the heart does not end up failing over time because it's been working so hard for so many years against pressure that's unnecessary. So lowering the pressure, lowering the cholesterol, those things allow your heart to function properly, not get enlarged and floppy. When you get an enlarged heart that doesn't work well, you start getting congestive heart failure. So people you hear all these things. It all starts from the basics of blood pressure being too high, making your heart work too long for so many years that it starts getting inactive, or what's the word I'm looking for? It just is not it doesn't function as well. So we end up doing an echocardiogram of your heart. That's like an ultrasound of your heart. We see the heart only ejects. It has an ejection fraction when it pumps and pushes things out. Injection fraction should be about 60. When you start getting 35s and stuff like that, your heart is not pumping well, which means at some point it's going to start giving out. And when you get heart failure, some people get heart failure, the fluid starts backing up into your lungs, congestive heart failure. You're now breathing water instead of air. So people have a hard time breathing. They land up in the hospital because they have fluid on their lungs. We have to give them diuretics. We have to tap them and drain it, give them IV diuretics. It becomes a set of problems that can be avoided if they just stick with the basics of eating right, monitoring their blood pressure. If they have blood pressure, take their medications until they can correct the problems. Adjust the diet corrects the problem. Getting the weight off corrects the problem. So when people start gaining more and more weight, we have to start giving more and more medication. When they start losing the weight, we can back off of the medications. When their blood pressure starts getting controlled and lower, we start dialing down their medications.
Well, can I tell you, I have a problem with my medication because I was really, really excited about, not having to take a lot of medication. And I had, maybe 5 or 6 pills, and now I'm down to like 2. But do you not know that when I was all excited about it, they said, oh, well, you need a multivitamin. Now I'm up to 3. Oh, well, you need this. Then I was up to 4. And before I knew it, even though I wasn't supposed to be taking any pills, I was back up to 5 with supplements. I'm like saying, so how can we win where we don't have to take this stuff?
Well, supplements are supplements because the diet isn't including all the things that are necessary. So if you ate and it's hard, if you eat a well-balanced meal with lots of green, all the colorful things that grow, the bell peppers and all the fruits and veggies that are colorful, those have a lot of antioxidants. If you look into the foods that give you all the things that you get in your multivitamin, your calcium, your magnesium, your zinc, and all that stuff that you take, there are foods that give you that. You just need to eat them consistently and make sure that you incorporate that throughout the day in your meals. And then adding a little protein. It doesn't have to be animal protein. It can be something else. You can have your beans and your legumes and things like that. You just need to figure out how you can eat a healthy diet so that you can avoid the supplement. But you know what? If you have to pop some pills, I'd rather you pop supplements than 4 hypertensive meds, 2 cholesterol meds, and 2 diabetic meds, okay? If you pop in 6 supplements and 1 blood pressure medicine and a cholesterol med, you're doing great. So just substitution for the supplements versus I'd rather you take the supplements than the prescription medications for the conditions that you have.
All right, because, that was the only thing I was like sitting up here like, I thought I was good to go, and then said, oh, no, you need vitamin B12. And so can we talk about this whole vitamin B12 that everybody thinks that everybody needs to take?
Well, not everyone gets tested for vitamin B12. And every one of them has a range. So vitamin B in general is, they have complex vitamin B, which is good for some stress and things like that. But there are different vitamin Bs that have like riboflavin and, folate and all that are necessary for certain things. Pregnant moms need folate levels. So we need to make sure they take folate. So these minerals are important for our body to work. We don't test all of them. We're not testing specifically riboflavin and vitamin B6 and B12, and we do 12 and all the other ones. I would just say a good supplement with multivitamin kind of covers all the bases. So that if you don't take in all of the basic foods in your diet to cover that, then 1 pill will do it. And then if you're low on things like vitamin D, we will supplement that because that is the basis of some of the underlying conditions, and we do need vitamin D to help with bones and all the other things. So we will supplement vitamin D when it's low.
Well, I'm going to ask the question because we're talking about men's health, and there's so many things that are happening out in the social media world. I just put up for you the latest crave that everybody is talking about, and that is soursop and black seed bitters. What's your take on this? Because they're saying take 2 tablespoons of both of these per day will change your life. It'll clean out your digestive tracts and everything will work well, including erectile dysfunction and everything else.
Well, from the minute they start saying that it's going to fix everything, you should be concerned about that. There isn't one thing out there that fixes everything. But I have never heard of black seed bitters. I don't get involved in a lot of basic supplements. Soursop is something that grows in my country, in Jamaica. We just kind of eat it. So I don't know why they're promoting those things, to be honest with you, but everyone that can make $1 is going to try to put something in it. I don't even know if it's regulated. So you have to be careful when people are telling you to eat things. Has it been regulated? Has it been tested? Does it interact with the medications you're taking? That's your prescription medications to take care of your basic health. So I don't go for fads. I'm sorry. I just don't. I don't believe in it. I think a healthy diet, drinking your water, doing the right things will keep you healthy. And if you monitor your labs, you'll get an idea on what's missing and then supplement that versus just kind of shooting in the dark. I don't know what those things are, and I don't know what their side effects are.
Well, I'm going to have to ask this to you, Dr. Afflalo, because this show is called Ask Dr. Afflalo. What is soursop?
Well, it's a fruit. It grows on a tree.
Is it bitter?
Yeah. I mean, it's not something I would just bite into and eat.
Oh, okay.
Yeah. We make drinks out of it in Jamaica.
Okay.
There's sweet sap and sour sap.
Okay.
Soursop. Yeah. So, but the fruits that grow on the trees have nutritional value. But what it's telling you to take it for, I don't know.
So you go to a tree and say, oh, that's a sweet one.
No, you can tell by how it grows, the size of it and everything, sweet sour soursop. There are all kinds of fruits, mangoes, and we have OTET apples. So everything has a nutritional value, nisberry, things that you've never even heard of, because these are fruits that grow in tropical places.
So what you're really saying is that we all need to go to your homeland for at least a month or two and get a good history lesson, and then then we can eat nutritious.
Yes, you eat the fruits and veggies that they sell on the side of the road.
Okay, because I know that you go back quite often.
Yes.
And everything. And when you go back, is that what you do, or is it that your family home? You just go out there and pick a mango and say, this is good.
You would be surprised. I had my neighbor call me the other day saying we have to go over there and pick up all that. There's like tons of mangoes falling off the tree and the OTET apples. I have pictures that's like hundreds of apples on the ground. So
now, what is ODD apple?
OTET apple is just a type of apple.
Oh, spell that for me.
I don't know how to spell it. OTET apple. You might have to look it up. Jamaican apple. It starts with an O. OTET apple. It's red on the outside. Looks like the shape of a pear. It's red. It can be bright red or burgundy, and inside is white, kind of a crispy type of thing, and it's very good.
Okay.
OTET. Don't ask me how to spell it.
Okay.
There you go.
Okay. So it does look like a pear.
Yeah, but it's crispy and it's white on the inside.
Okay.
Yeah. Otahiti. See, that's not how we pronounce it.
Okay.
Otahiti. Yes. But anyway, OTET apple is what we call it. And it's my tree when I went home a month or so ago was laden with it. And then now they've all fallen off.
So my question is, can we get an OTET apple in the United States? No. Oh, you can?
No. These are grown in tropical places.
So they don't even import them in, or they don't allow them to come in?
I don't know if I don't think, we normally cannot transport. I mean, unless you have some kind of a arrangement, like we can bring mangoes and things in from Chile and Venezuela and Mexico and stuff. I don't think there's any kind of trade with that. Otherwise, we would be able to bring it in. I just have never seen one over here. So if you have trade, if we're exporting things, then yes, you can bring those types of things over. Soursop, there's your soursop on the tree. We have so many different, jackfruit is a very big fruit that we have there in Jamaica too, and they make a lot of things here. The jackfruit they use for like in place of meat.
Yeah.
So you can you can make it for like, see that? It's an interesting looking fruit. So the soursop.
Okay.
Yeah.
Well, this is very, I think, very, very important because, people will talk about the Japanese culture and the Chinese culture and saying that they live a lot longer because of their diet and the things that they have from ancient teas and things of that nature. My question is that all true, or is that just the fact that their lifestyle of what they eat? 'Cause they eat a lot of pork and they eat a lot of rice. And it seems like carbs and fat doesn't seem to go together. But, it seems to work for them.
And you don't see a lot. Well, they do have a lot of heart disease.
Okay.
But you don't see a lot of fat and obese Asian people either. They're active. They walk
The
around.
sumo wrestlers, they
Well, no, that's a deliberate.
okay.
You have to fatten up to be that. But
Yeah.
your average person walking on the street is not that. So their diet does makes a big difference. They eat a lot of fish.
Yeah.
They eat a lot of rice, but they have balance. They eat a lot of veggies, and they're active. They walk. Not everybody in their country can drive, so they do walking, bicycling, things like that. So you have to balance it out. Americans tend to be on the lazy side. We get in a car, we go from point A to point B. We don't do any formal exercise. We don't work for our food. We're not out there picking in our gardens and working our gardens. So we've just become kind of complacent because everything is convenient.
Yeah.
And we've fallen into the convenient of TV dinners and packaged goods, and so our diet has changed. If you think about it, it's our diet, because when people come from like Africa and other countries and come here, they get morbidly obese, they get all the chronic diseases that we have. It's the diet here.
So I want you to answer the question from Brother Peterson. He said, during my yearly physical, I get a comprehensive lab panel. Are there specific tests I should ask for that's not screened or comprehensive panel?
Yeah, it depends on which lab, because some comprehensive lab panels have a lot in them, like 10 and 15 different labs. So you want to make sure for your age group or whatever, make sure you're asking for a PSA if it's not in that. It may not be in that because some of them are metabolic. So there's going to be your creatinine, your CBC, your thyroid, those types of things. But you may want to make sure you're specifically asking for a PSA. They will have cholesterol and other things in that particular panel. You can get a printout of what's in that panel, because every panel, you can have a Chem 6, a Chem 12. Those are all chemical panels, but some of them have more than others. So I would find out what the printout is of their comprehensive panel, and then whatever is missing, ask specifically for those.
Okay, you are giving it to it. Here's the last question of the day. All these meal prep services that say they will deliver the meal to your house, is it real? Is it healthy? Is it wise?
Well, it's a lot of money. I mean, I think it's for convenience, because they will put together the thing or the ingredients and have you cook it, so you don't have to go and shop for it, and they'll have meals kind of pre-cooked and you just nuke them. Yeah. That's a shortcut. I guess it's better than driving through McDonald's or any other fast food place and getting the fried stuff, because you can prep it. So the meal preps would be a little bit better than the ones that are prepped, because we don't know what's in them, that you just warm up in a microwave, because you have no control over it. But they give some of these programs give you like packages of things that are already, your veggies cut up and this cut up and all the things you need to make your meal, and then you prepare it yourself, meaning you put in your seasonings, but what you need is already there. I've never investigated any of them. I just like to cook for myself. And so if you have to choose one of those for the convenience, but it does cost a lot, I would rather you get the meal prep that has everything there, so they've done the shopping and the portion control for you, and you just stir fry it or whatever in your skillet and make your meal.
So last two questions. One question comes from our listeners. What about lung tests?
Lung test?
Can you get lung tests?
There's no real screening test. If you have a history of smoking, a baseline chest X-ray, and possibly the American Lung Association is providing free CT low radiation CT scans for people that have a history of smoking. So a CT scan is available to look for any cancer. And then pulmonary function test, that's when you go into this machine and you blow into things. That's when you're having any kind of a symptomatic problem, because that's how we diagnose COPD, chronic obstructive pulmonary disease, or asthma, is to get a pulmonary function test. But that means you have to come in symptomatic. We don't do that it's not a screening test for everyone. It's a diagnostic test to find out why you're having shortness of breath or wheezing, right?
So last question of the night, and it's a big one. If we were coming to dinner at Dr. Afflalo's house, who'd like to just cook, what would our meal look like at a Dr. Afflalo house dinner table?
Well, I love salmon, so it would be a grilled or a blackened salmon, and it would be either steamed veggies, I love veggies, or a nice big salad that has every color you can think of, including blueberries and tomatoes and stuff. I have garbanzo beans grilled or stir-fried garbanzo beans or air fry. So that's a meal by itself because it has the protein in it, it has everything in it. That's what it would be. I don't really have much of a carb, but if I did, it would be like those small potatoes that would be air fried or something.
Well, there you have it. The culinary stewardship and chef of Dr. Afflalo. This has been a great show. I think we covered a a lot of area. I think people are tuned in and asking the questions they need to ask. This show is not a show that is going to give you medical advice, but what it will do is it will have the discussion. But we want to encourage each and every one of you all, if you are going through any types of symptoms or things that you're concerned about, consult your physician so that you can know the facts. And if you're afraid of going in, all you got to do is tap into IWC Primary Care. They will take care of you. It'll be just like home, and you will enjoy it. Dr. Afflalo, any final words?
No, just remember the health fair is on June 4th. Come on out and get your routine screening and get your free produce.
All right. Well, you all have a blessed evening. This is from Ask Dr. Afflalo from GODRadio1.com.